Good morning, everyone. I'm Lindsay Goldfarb, Director of Healthcare Education at the Massachusetts Health and Hospital Association. And on behalf of MHA, welcome to today's Executive Insights webinar. MHA is excited to continue this series, which features candid interviews of the leaders who power our hospitals and health systems. Today's theme is expanding the circle. A few logistics before we begin. We'll be recording this session for those who aren't able to join us, and all lines will be in listen-only mode. If you have questions during the webinar, please type them into the chat box. The questions will come directly to us, and we'll do our best to address as many as we can during our time today. Following the webinar, we'll be sending out the webinar recording along with a brief survey. I'd also like to take a moment to thank MHA's 2021 sponsors for their support in underwriting MHA's education programs. In particular, I'd like to thank today's program sponsor, Verrill. A nationally prominent law firm, Verrill has been a longtime member and supporter of MHA. Now I'll hand it over to Gary Rosenberg, counsel at Verrill, to say a few words. Gary, over to you.
Thank you, Lindsay. As we all know and have experienced, the last couple of years have been some of the most challenging times for healthcare institutions of all sizes and specialties. As we near the second anniversary of the pandemic, healthcare leaders still are faced with challenges of navigating new federal and state regulations, ensuring the safety of their employees, personnel, and patients, and furthering telehealth capabilities in today's environment. At Verrill, our healthcare and life sciences attorneys have been helping those in the healthcare industry navigate these challenges and evolving areas of law. We pride ourselves, however, on not only staying abreast of changes in healthcare law, but also being on the forefront of industry trends and best practices to best serve the ever-evolving needs of our healthcare clients. Today, we will hear from Jody White, CEO and President of Lowell General Hospital and Circle Health, who, despite the increasing number of challenges facing the industry, has led the hospital in accomplishing great success and recognition. Without further ado, I am pleased to introduce our moderator for the morning, Steve Walsh, President and CEO of the Massachusetts Health and Hospital Association.
Thank you, Lindsay, and thank you, Gary. And thanks to Verrill. You've been an incredible partner to us at MHA, and more importantly, to our members and the patients that they serve. And we really appreciate you standing with us over the past few years as we continue to provide incredible service to our members and to their communities. This is going to be a great morning with my friend and immediate past chair of MHA, Jody White. It's the final Executive Insights episode of 2021. I know these conversations have been a highlight for all of us at MHA throughout the year, and I'm thankful that you continue to start your morning with us to hear from some of the best healthcare leaders in the world. To cap us off, it's really my pleasure to be joined by Jody. Jody's the president and CEO of Circle Health and Lowell General Hospital, and Executive Vice President of WellForce. Prior to his 2017 appointment to CEO, Jody was president of Lowell General Hospital since 2013. He previously served for 10 years as Executive Vice President and Chief Operating Officer of the hospital. Since Jody joined the leadership team, Lowell General has earned both regional and national recognition for its quality of care and its work environment. Jody now leads the effort to fully realize Circle Health's vision to be one of the best integrated healthcare systems in America. Jody serves on numerous boards within the state, and as I said, is our past chair here at MHA. He holds an MBA from the University of New Haven and a Bachelor of Science in Allied Health from the University of Bridgeport. I'll also add that Jody is a key member of our executive committee and played the most integral and important role in coordinating our entire system's COVID-19 response over this past 21 months. Jody, thanks so much for joining us and welcome.
Hey, Steve, good morning. Very generous opening comments. Look forward to our conversation this morning.
Well, to kick things right off, it's been fascinating in these sessions to hear how our CEOs landed where they are. And so I'm going to start right at the beginning. What sparked your interest in healthcare, and what's your journey looked like leading up to your current role at WellForce?
Great question. I consider myself a bit of a non-traditionalist, Steve. My healthcare career began back in Connecticut as an emergency paramedic, and working the streets during some of the most critical times of healthcare, and eventually earning my way into Stanford Hospital as the director of emergency services with a wonderful executive team and a chief operating officer that given me a chance to push and to learn and to grow. Moved from there up to Middlesex Hospital in Middletown, Connecticut, where I was a vice president for administration and worked hard with a number of really talented folks in the Connecticut market until a recruiter from Whitkeefer found me and said, why don't you come up to Lowell in Lowell, Massachusetts in 2003. And Pam and I took a look at it and said, we think that's a heck of a good move. And up we came and joined Lowell General Hospital as their chief operating officer in 2003. Lowell had the great good fortune in 2012 to take the two hospitals in Lowell, then Lowell General and Saints Medical Center, and bring them together to form Circle Health. And we've had a wonderful time ever since. In 2014, Circle Health took a step back and said, are we big enough to stand alone? And what else can we do to grow our vision for being an amazing hospital that puts patients first? And we had a great conversation with Tufts Medical Center and said, why don't we form something together that might set a new course for healthcare in the Commonwealth? And in 2014, Tufts and Lowell General came together to form WellForce. And Mike Dandorf's our CEO. WellForce is a growing entity with Melrose Wakefield and Home Healthcare Foundation joining. And we're off some amazing times moving forward. So I've had an amazing career, Steve. I've been the CEO of Circle Health now for the past 6 years. And it's delightful to be part of a great system with Mike Dandorf's leadership as we look to perhaps rechart some things for healthcare in the Commonwealth.
So you're a leader that wears many different hats, and you mentioned a few of them, and I'll mention a few of them, and I want to dig into it a little bit. You manage a large community hospital, a regional healthcare collaborative, and one of our state's largest healthcare systems all at the same time. How do you do that? How do you keep all of those things straight on a day-to-day basis?
Well, first, it's a privilege to be asked to serve in a leadership capacity, and I don't take that lightly. It's an honor to serve. When you're serving and you're asked to serve more, the only way you do that, Steve, is by relying on talented people that work with you to continue to keep the good fight going. And I've had the great fortune and great pleasure of working with an amazing executive team at Lowell General Hospital and Circle Health, helping to lead Yankee Alliance with another amazing group of folks, an executive team there that does some superb work, and then certainly working with WellForce, and then of course the work that I've been able to participate in helping MHA during some difficult times over the last 18 months or so of COVID. I think the answer to it again is that this is not a one-man game, it's a team sport. And if you've got great people working with you that can allow me to take on additional responsibilities, to be able to support and help, you can't do that unless you've got great colleagues, great associates, and very talented teams that are in place to keep the home fires burning and making sure that everything's going as it should. So I'm very grateful for the folks that I work with that support our organizations and our efforts and have allowed me to contribute in many ways.
I want to go into that a little bit. And you mentioned MHA, you mentioned Circle. We're gonna come back to those, but I want to talk about your leadership in the hospital for a minute, because you mentioned your team. I've visited a lot of hospitals, as you know. I've walked a lot of corridors with a lot of CEOs. There's something happening there at Lowell with the culture, and I know that's due to your leadership. Can we talk about that a little bit? You know everybody's name in the building. We walk through the halls. You have a presence to you, a positivity and a humility that seems to resonate through the entire culture at Lowell. How have you built that? And what does that mean to you to be able to walk around and no matter where we were in the hospital, you were asking somebody by name what was going on with their family, what's happening in their neighborhood, how their day was going, if they needed anything to fulfill their job better. How do you bring that positivity to your work day in and day out?
Well, thank you for that. I think it's just a commitment to servant leadership and to remembering that those of us that are tasked to lead have been given an amazing privilege, but also an amazing responsibility. And leadership that puts patients first, leadership that puts employees first, and realizes that if we're not inspiring, if we're not engaging, if we're not equipping, and if we're not leading in a way with great transparency and great integrity, that we're probably in the wrong place. When we have leadership meetings at the hospital, and I'll grab our leaders together, we'll talk about our employees. One of the statements I make is this: whether you're a line supervisor in food service or one of the vice presidents, the people that work for you, that are responsible, you're responsible for them. I keep telling them, you're the only person they've got. If you're not on your game, if you're not inspiring, if you're not optimistic, if you're not equipping, enabling, looking to get them their next job and really being in their corner, then they're going to miss. Because if you're not on your game and looking at, as a servant leader, to make their work meaningful, to make them effective, and above all, to help them to grow, then they've missed a great opportunity. And I think that's what leaders have to aspire to do. We've got amazing responsibilities, amazing opportunities, but with that comes a very important responsibility.
Jody, I'd like to capture what you just said and give it out to all of our leaders. I think it really is important words and really makes this morning meaningful. So we talked about within the hospital. Now let's just move outside the walls just a little bit. Your leadership at Circle Health really speaks to the mission of bringing quality care to new and underrepresented populations. What has been your approach now as you go outside the walls of the hospital to widening access to care to the greater Lowell area?
Well, it's been a lesson, Steve, that we've learned. I think it's been enhanced by the pandemic. There's always a silver lining here, right? Lowell is a very diverse community. We've got the second largest Cambodian Southeast Asian population in the U.S. other than San Francisco. We've also got an amazing community that's committed to the success of the community, and we play a large role as the largest employer in the community, and of course, the healthcare provider for our community. To answer your question, what are we doing to enhance or to reduce healthcare disparities and get care for all in Lowell? It gets back to relationships, and one of the things that the pandemic has shown me, and I think has benefited our community, is that folks that tend to work in silos are not effective as folks that tend to work together. And in Lowell, whether it was the Circle Health and the healthcare system, the University of Massachusetts Lowell, led by Chancellor Jackie Maloney, stepping together with us to develop field hospitals. Steve, you recall, we opened 2 field hospitals in Lowell, or a field hospital twice in Lowell during the pandemic. An amazing relationship. City Manager Eileen Donahue bringing the full forces of the efforts of the city to bear during the pandemic. And then the Greater Lowell Health Alliance, which is an organization that we started and support, which brings all the leaders and thought leaders and effort leaders across Lowell together to improve health in our community. So it's a team sport. It's the ability to engage beyond the 4 walls. It's the ability to excite leaders about an opportunity to improve health. But above all, it's having a vision. It's having a vision that says we can do better than this. We can always improve. And by teaming up with others, including the university and the city and the Cambodian Mutual Assistance Association and others, we can have a positive impact if we do it together with great inspiration and great enthusiasm.
So you're leading me right where, of course, I wanted to go, which is to the next area I want to discuss, which is about building those teams, working together, collaboration. So let's start with your discussion that I hear from you regularly about a move to value. You've talked about partnering better with physicians and other members of your care team to accomplish your goals, moving us away from the system that really many would argue is broken and too expensive towards a value-based system. How have these relationships helped that direction? And what are you trying to do at Circle and WellForce to move the system forward?
Well, the first statement is that we are so fortunate to be in the Commonwealth of Massachusetts with the greatest healthcare engine in the entire world. The world's best hospitals are here in Massachusetts. The world's best health thinkers are here in Massachusetts. And we've got an amazing healthcare economy that's driven us along beautifully. I think that the fundamentals of the healthcare system need to be challenged just a bit, because I think the days of fee-for-service, where we simply get paid to do things to folks, need to shift. I think our incentives need to get more aligned towards improving health. And a big part of that, Steve, is by engaging our physicians in all new ways to partner with our docs to find ways to improve health across our community versus having patients admitted to a hospital bed or having a procedure done. I think the physician's voice has been muted, especially in the larger decision-making across, certainly inside our system. And we've worked very hard over the last 10 years to be sure that the voice of our doctor, who has our patients, physicians bring patients to us and they share them with us, giving them the appropriate voice to be sure that we are focused on the right things, has been an amazing opportunity for us, and one that we're going to enhance and expand upon. Our ability to deliver frictionless care, our ability to have folks practicing at the top of their license and bringing joy back to work in healthcare, including our physicians, and the ability to move care out of the 4 walls of the hospital and closer to places where patients find it more comfortable, easier, less expensive. I think these are all noble goals and a calling that certainly we at Circle and of course at WellForce are looking to do as we perhaps push away from the traditional reimbursement systems and the traditional incentives that align us to do things to people, and perhaps align our payment systems in partnership with our payers, our patients, and the folks that deliver care to find a way to improve health and challenge some of the traditional healthcare thinking.
I think it's exciting. Look forward to seeing more from you and your team in terms of how we get there moving forward, because it certainly is going to be an important part, in large part to some of the challenges we're facing right now. And we'll get to present day in a minute. I want to hit rewind for a second. Let's go to the last day of our daily calls, and then we'll work our way backwards. I don't know if you remember this moment we had in the last day. We had done this for how many months together, almost every morning at 7 a.m. We had a moment with our phone operator, right? Because we got to know Katie in Minnesota or wherever she was, right? Because she was a part of the family every morning, 7 a.m., 72 CEOs, Katie opening up these calls, talking about load balancing, what was happening in each region of the state. And certainly you led us so incredibly well. You put the needs of the Commonwealth ahead of the needs of your system. You just talk a little bit about that time, what it meant for you to be the leader of really all of our institutions of MHA at that moment, and bringing us together, the collaboration that happened. A lot of people have talked about it in these mornings, but I know you have a different vantage point as the one that was really convening us. Just talk about what that meant for you as a person, and then also in terms of your now more profound relationships with your colleagues.
Well, that was a high point of my professional career, to be asked, A, to be on the board at MHA, and B, to end up chairing the Massachusetts Health and Hospital Association. It just so happened I was picked to do that duty as the pandemic came on. And I had the great fortune, Steve, as we had talked about extending my service and term as chair from 1 year to 18 months, as you and I together decided, listen, we've really got to stick together and try to work our way through this pandemic. It was a professional challenge, and I think most of the CEOs would say this has been the hardest times in our career, with a pandemic that we knew very little about, and we're really kind of making the rules up as we went along. But the reality was this: I've never been prouder of a group of CEOs across the Commonwealth of Massachusetts who put their independent interests aside, who put their day-to-day operations aside, and all stood together and said, we have got to make this thing work. And I think, Steve, the books that will be written and the analysis that's going to be done, it's going to find that Massachusetts stood very, very well during the pandemic. Steve, your leadership as our CEO, the ability to help to bring the resources of MHA together, and teaming up with your board to help us stand tall, to partner with the secretary, to partner with the governor, to partner with the National Guard, to set up field hospitals, to move patients around for the best places for care at the right time. And above all, to set the stage for what I believe was as good as we could have done, success in helping to save lives, curtail the carnage of a pandemic, and try to meet it head on with the full force and resources of Massachusetts. Only Massachusetts could have done it, I think, as well as we've done it. I was proud and very, very proud to be of service as the chair of MHA during these difficult times. But I am so in awe of all the CEOs, of the secretary, the governor, and the teams that stood together to really pull off what I believe was a very, very fine response to the pandemic. And I continue to be very proud of what we've been able to continue to do together.
So we talked to Dr. Dixon, and we talked about that day that he's walking through the DCU center, right? The field hospital. I mean, who envisioned these things? And you have a background in emergency medicine. He had a background in emergency medicine. Talk to about that day. You talk about your partnerships and collaborations. You had a great one with UMass as well. You're walking through UMass with the governor, I think, the secretary. You've just set up a field hospital. What are you seeing? What was that like?
Well, it was very unusual to be walking through the UMass Rec Center with Chancellor Maloney, the secretary, and the governor, and looking at 100 cots with X-ray equipment, laboratory equipment. We brought the full EHR network from the hospital into the recreation center at UMass Lowell. We had every bit of hospital capability functioning inside that rec center. And a couple of times the chancellor and I looked at each other and said, have you ever seen anything like this? Did you ever envision that your rec center was going to be a field hospital? And to her credit, she gave us that center willingly. This was a big challenge for them. They were trying to deal with students during a pandemic, and the one relief the students had was getting to the rec center. And we took it over not once, but twice. It was really a humbling time, but it was also an extraordinary time. And it just showed I think the order of magnitude of just what we were dealing with. These were things that you would have never thought of doing, but we did them, and we did them well. And hats off to Eric. The DCU Center was 5 times the size of anything that we pulled off in Lowell. But the wisdom through the secretary and the governor to find the right spots, open up Boston, open up Worcester, open up Lowell, Cape, everybody stood together to do some extraordinary things we'd never done before. And it really was quite impressive.
Let's just talk personally just for a second, because a lot of folks have heard about the COVID response, and yours is certainly unique, having been the leader of our the leader among equals, so to speak, of all of our institutions during that time. But you also, I think, added a grandchild at the beginning of COVID and then another one at the end of COVID. And I know your family life is important to you. I know you do a lot of fun stuff with your team, bringing them up to the house whenever you can. Talk a little bit about what the grandchildren have meant in terms of keeping you young, keeping you active.
Well, they do that for sure, Steve. Pam and I have been married for 40 years, and actually going out for 46. We started seeing each other as juniors in high school, and it's a wonderful story. She's my best friend and my best ally. We've got 3 wonderful boys, and I've now got 5 wonderful grandchildren, all under the age of 3. So this will be a wonderful Thanksgiving and Christmas. We find every moment we can to spend time, and it's a big part of what keeps me charged up and moving forward. There's nothing like family, nothing like the love that family brings, and the empowerment and the inspiration. And I'm just a very fortunate man.
Well, thanks for sharing that. And now another personal question, one a little lighter. Do you own a straight tie? Do you own a long tie, Jody, or is it only bow ties?
No, I do not own a long tie. I have 147 bow ties, and I do not own a long tie.
I'm impressed that you know the number. Had to ask a light question before I ask a hard question. The system's facing some challenges right now, and so not to bring it back to reality, but we made it through the height of the pandemic. We came out of it a little bit. People desperately want to go back to a new normal. Thanksgiving with family. Again, no one wants to do what they did last year. The holiday season is upon us. But the hospitals are really full, right? Things are really tough. You talked a little bit before we came on, workforce challenges. Your frontline team is tired. You're full. Can you just talk a little bit what's happening in the hospital now, and how do we move forward? How are you managing through this second crisis?
Yeah, the second crisis is right now that we're dealing with, and you said it correctly. It's simply capacity and our ability to staff. I don't think there's a CEO in the country that's going to say that we're not feeling it. The census across the Commonwealth now inpatient census is as high as it was at the height of the pandemic. It's not a COVID problem right now. At Circle, for example, this morning we have 30 COVID patients, but we're on code capacity with only a couple of beds open to us. Folks that are coming into the hospital, I think we're going to look back and say that the morbidity of COVID has a lot of folks that have put off care for too long and are now coming back into the hospital too sick. Whether it's Eric out in UMass or the Boston hospitals, everybody is full. Care is it's a challenge getting folks into quaternary beds anywhere across the Commonwealth, and hospitals like Lowell General Hospital, a regional center, we've been full and continue to be full, and our staff is stretched. We've got travel nurses in the hospital now. We rarely use travel staff, but we have to, and it's an important part of what we're doing. So there are challenges out there. I'm hoping that we can get through the next couple of months as volume tends to tick up after Thanksgiving. But we are going to celebrate with our staff. We are going to round like mad. We are going to be sure that we are front and center in encouraging and inspiring, equipping what our team needs, and above all, showing them that we put patients first in everything that we do. It starts with the executive team right on through the hospital, and we're going to make sure that we have a very happy holiday, celebrate the wins that we've had as an organization, and double down on putting patients first. It's about inspired leadership, Steve. It's about equipping folks to get work done. And yes, we will get through these challenging times, but they are indeed challenging.
Thanks for that. And again, thanks for always taking the positive approach to this. And I know that's important for your team at Lowell General, for your staff, because they're in it every day. We always have a lot of emerging leaders on the on our morning coffees here. And can you just talk a little bit, what advice would you give to emerging leaders coming up through the system? And especially in a time where people might be thinking about moving away from healthcare because of the challenges of the last 20 months. Can you talk to our new leaders a little bit?
Yeah, Steve, thank you. I'd love just a couple words of encouragement. The first would be remain optimistic. Healthcare can be a business that if you let it get to you, you can find ways to get negative very, very quickly. So I would say remain to be eternally optimistic because your staff needs you to be optimistic. And if you're going to lead, you've got to lead with a big smile and a big dose of courage. Don't be afraid to challenge the status quo. Healthcare, I believe, will benefit. Healthcare will benefit from new thinkers, smart thinkers that are willing to take a look at how are we doing our work today, but what can we do differently tomorrow to perhaps disrupt some of the traditional things that we've done that I think have helped healthcare just a little bit stuck. We're still too expensive. We still have too many patients in hospital beds. We still are hanging on to some of the traditions that we've all done throughout our careers and looking for more of this and more of that. I think we need to focus more on doing less of certain things and helping people to find ways towards health and aligning incentives towards health. And that'll help us to, I think, move the needle in a bit of a different direction. And I hope our younger leaders coming up will be inspired to grab on to some new thinking, because maintaining the status quo, I think in any playbook is a bad move. And I think there's opportunities going forward to lead, to change, and to be somebody that is actually helping to drive our healthcare system forward in new ways to put patients in the middle, lower the costs of care, continue to improve quality in our journeys towards high reliability and amazing quality for our patients, and above all, putting patients first and meeting their needs where they need us to meet them.
You know, Jody, you use that line, putting patients first. It's kind of been your hallmark line. We're putting patients first. You ended every call with it over the course of months and months and months. And it really stuck. I mean, really, people started talking about putting patients first. That's how we talk about it. It's so important. And I think in these difficult times, that's the message, right? As long as we put patients first, we'll continue to do the right thing for our communities, for our patients, for our teams. Our time is coming to a close. Jody, I just want to say thank you. And in the spirit of Thanksgiving, I just want to say how thankful I am for our relationship, our friendship, your mentorship, and your leadership in these trying times. Certainly appreciate all of those that are joining us this morning and wish them a happy and healthy Thanksgiving. Your work in the Merrimack Valley has been an incredible source of pride for our entire healthcare community. But the example you've set as a colleague and a collaborative voice has meant just as much, if not more. We're looking forward to seeing everything that you and your team have in store in the months ahead. Thank you again to Verrill and to all of our sponsors and to all of you, our attendees, for once again being part of today's Executive Insight series. MHA offers great programming on a weekly basis. We encourage you to visit our website for more information on what we have in store. You can join us at our next Executive Insight session on January 12th, when we'll be joined by Dr. Mark Kerouac, President and CEO of Bay State Health. We also encourage you to mark your calendars for MHA's upcoming Joint Commission Update Conference in January. Stay tuned for more details and make sure you register today. Thanks for spending your morning with us here at MHA. We wish you a happy and healthy and safe holiday season. Look forward to seeing you again in January. And Jody, thank you so much for joining us this morning, for your inspiring words. And I will give you the last word this morning, as I did on so many months in our morning calls. Thanks, Jody.
Steve, thank you. And above all, thank you for your leadership and the MHA team. Behind the scenes, one of the engines inside healthcare is MHA, helping us to stand together to improve care for our patients and to indeed put patients first. So thanks for all that you guys do, Steve.
Thank you, Jody. Hope everyone has a great morning.